are considered making an universal recommendation for the return of the children and kids to school, basic measures, because the behavior of the transmission in this population is really unknown. There are different points of view. And the other questions, it's about if there should be a global unification of data accounting in order to make more comprehensive comparison of the situation between countries, about a confirmed case, suspected case, and death.
Is actively engaged with educationalists around the world and others, and we will be bringing further technical advisory groups together around the whole issue of school and risk management at school level. It is very difficult to give a universal recommendation around school opening or closing. As you can imagine, the contexts are extremely different, the epidemics are very different, the vulnerability of children in different settings is very different. School is a very different concept in many parts of the world, and the age stratification and what you do in young children versus older children versus adolescents versus universities. So it's very difficult to make universal recommendations. We have issued considerations and very detailed considerations for the risk-based decision making that governments should make. But maybe Pastor, maybe Anshu may have a comment on this, and maybe Maria can take the question on the bringing together global data.
Negative impacts of closures of schools, and at the same time also we have seen that it has an impact on transmission. So what's very important for us is to identify better what the impact has been of closure of schools on transmission in the community, and that's something that we're looking at the moment. We have also identified that closure of schools has contributed or will contribute to poorer educational outcomes, to mental health issues, as already mentioned by a previous speaker, but also to poorer nutrition. Many children actually depend on a meal at school as part of for their nutritional status, as well as looking at the impact of violence against children, also highlighted earlier. So I think we need to really look at the balance. What is the risk or what is the impact of closing schools on the impact on children versus the transmission in community, and that's something that we're studying at the moment.
Considerations to reopen schools. As Mike has said, we have issued guidance around this because it is very context specific. And when taking that decision, there's a number of factors that need to be taken into consideration, including the current epidemiology and transmission, intensity of transmission of COVID-19 in the area where the schools are and where the children live that go to those educational institutions, and also the setting that the school is in or that institution is in. What is their ability to maintain the ability to prevent and control transmission of COVID-19? And so what we've done is we've tried to outline these considerations to help the decision makers take the decision of when and how to open those, looking into the school policies, the resources, the infrastructure that the school has, the policies not only for the school staff but for the students themselves, looking at the different behavioral aspects or the age considerations. Obviously, for younger children, there are different considerations for those that are at university or even in a high school level, looking at hygiene and environmental cleaning within the facility itself, looking at the ability of the system, the school system, to be able to screen for cases, detect cases. What is the plan if you do find a case through the school itself? Education and communication through the parents and the students themselves. So not only talking to students, but listening to students and feeding that back into the plan. And looking at the ability to put in physical distancing and other public health measures that also need to be taken into consideration. So as Mike has said, as Anshu has said, it's very context specific. And so to set one policy is very difficult. And so what we're trying to do is help the decision makers take those decisions to reopen schools safely. With regard to the second question around global data, so indeed we do have systems in place to capture data from countries around COVID-19 cases. We have the mechanism through the IHR where official cases are reported to us through the IHR mechanism. We have issued case definitions, which helps to define who is a suspect case, who should be tested, because as you know, our recommendation is to test suspect cases, and there's definitions for who those suspect cases are. And we have also issued guidance around surveillance systems. How would one find suspect cases? Looking specifically at different populations and looking for cases in the community. And so the mechanism by which we capture that information is through IHR. And we have teams that are working to analyze the data that comes in to help us better understand the situation, the transmission situation, and the characteristics of the cases reported.
I think the question on data is extremely important. And I just wanted to remind all that the Global Action Plan on SDG 3, which relates to data and digital health as an accelerator of universal health, is something that WHO and UNFPA have been co-leading. And here the cooperation at the country level, where we never take our eye off of 2030 and the Sustainable Development Goals, even with COVID. The cooperation of country governments is extremely important as we strive across the 12 global health organizations, which are signatories, to align and accelerate and account and engage with governments on comprehensive, modern, and functional health information systems. Really depends on all sectors working together at the national levels. Thank you.
Related areas, there are clearly differential impacts in different populations. We've seen the impact in Amazonas, but overall, the health system is still coping in Brazil. Though having said that, with the sustained number of severe cases, that remains to be seen, and clearly the health system in Brazil across the country needs significant support in order to sustain its effort in this regard. But the data we have at the moment supports a system under pressure, but a system still coping with the number of severe cases.
More children for COVID-19 so that we can get a clearer picture on how it affects children and adolescents.
I can start, and perhaps others may want to supplement. I mean, I think one of the areas of our understanding of this pandemic that's really limited is our understanding of COVID-19 in children and adolescents. And so we have a number of unknowns that we're really trying to better understand is how often are they infected? Do they play a role in transmission? And if so, how much are they playing in that role? What roles do schools potentially have? And these are a number of areas of unknowns. And certainly there are some surveillance look at children is important. Surveillance in all different populations is important. And there are a number of other ways in which data that could be collected for children, particularly with schools reopening in some areas. And we should note that in some countries, schools didn't close. There are also seroepidemiologic investigations that are underway. That some of those include children, and that will also give us more information about the extent of infection in children.
Prevalence in children, and I know colleagues in the UK have launched an extensive seroprevalence study looking at the experience of children of infection, not just of severe infection, and understanding the mild pattern of disease and how children participate in the overall transmission of disease or not, and then looking at the more severe end of the spectrum and why some children, very few, end up with severe outcomes from the disease. These are really all very important, interlinked but independently important measurements we need to make. And notwithstanding what Antju said, there are other negative impacts of this COVID-19 pandemic on children which may not be measured in serology and they may not be measured in hospital admissions, but may be measured in educational attainment and psychological stress and in disruption to important developmental milestones that we all hope our children reach at the appropriate time.
A crucial question in terms of surveying the epidemiology of where we're going, but the bottom line is how will we pay for the additional testing once available? And Gabriela may wish to speak to the importance of parliamentarians as the budget setters on the ground where it counts. The guidance is there and the invitation to do things is there, but what really turns into action is what countries decide. So I'd like to be very clear in the role of parliaments in influencing the budget allocation if we need more testing among an adolescent or a child age group. And there are barriers to resource mobilization at a time when economies are struggling and worried. So I think not just the policy barrier, but also the